Well, hello everyone, and welcome to this edition of our quick convo sessions that we're having and hosting by the FARM program. As a reminder, these quick convos are short conversations about 30 minutes or less that we're streaming via Zoom and Facebook. And during this time, we're just briefly introducing all of the FARM program areas and having just a short discussion with the FARM team members and really opening it up for questions from hopefully dairy farmers and other industry folks about the different subjects that we cover within the FARM program. So before we get started with today's session, just a quick reminder that we really encourage you, if you have questions, to submit those. And if we have time at the end, we'll definitely be sure to answer those live. There's two ways to ask questions during these conversations. One is via Zoom. So if you're watching via Zoom, you can just hover over the bottom of your screen and highlight the chat feature or the Q&A feature and submit your questions that way. Then if you are watching over on the Facebook Live side, you can just type your question in the comment box below and submit questions via Facebook. So before we get started, just to introduce our topic today and our team member that's joining us today, today's session is focused on antibiotic stewardship. And so with us, we have Jamie Jonker. So Dr. Jonker, if you want to take a moment to introduce yourself.
Great, thank you, Beverly, and it's my pleasure to be here this afternoon if you're on the East Coast, or this morning if you're in the central or earlier time, further west time zones. I am Jamie Jonker, Vice President of Sustainability and Scientific Affairs with the National Milk Producers Federation, and I am the oldest and longest serving member of the FARM team, having been the initial staff person for the FARM program when it began way back in 2009. And so I think, the question is, what is antibiotic stewardship? I think antibiotic stewardship really boils down to the judicious and responsible use of antibiotics to control, prevent, and treat disease in our dairy animals. At that very basic level, what that means is that antibiotics are an important tool in the toolbox to assure the health and welfare of dairy cattle. However, it's not the only tool in the toolbox. And there are many things that dairy farmers do day in and day out to keep their animals healthy. But in the event that the animal does become sick, an antibiotic might be the appropriate course of treatment. And so at the end of the day, antibiotic stewardship is really choosing to use an antibiotic at the right time for the right disease.
Thanks for that overview, Jamie. And I guess to get us started, can you just give us an overview of how NMPF, the FARM program, yourself, represent the dairy industry in this space?
Certainly, Beverly. Antibiotic use has a lot of interest in it from our customers, our consumers, and the general public. And because of that, there's a lot of activities that happens at the national and international level. National Milk participates in a variety of different places where antibiotic stewardship is defined. On the bottom left there, you see the Grade A Pasteurized Milk Ordinance. That is the milk licensing process done at each individual state, where every dairy farm is inspected multiple times per year. Part of the Grade A Pasteurized Milk Ordinance is the routine testing of all milk for antibiotics once it's picked up from the farm. And of course, National Milk participates greatly in the Grade A program, including what's called Appendix N, which is the part that defines the residue testing that occurs in milk. On top of that, you see the World Organization for Animal Health. That's the international intergovernmental organization that oversees animal health. It's recognized by the World Trade Organization, so the standards of the OIE can impact international trade. So National Milk participates both here in the US with USDA, which is the partner that represents the US in the World Organization for Animal Health, and at the international level with the International Dairy Federation, which you see on the right-hand side here, to represent the interests of US dairy producers and also the global dairy community. We participate in what's called Codex Alimentarius. That is an additional international intergovernmental organization that sets food safety standards. Also recognized by the World Trade Organization, the food safety standards that come out of Codex are also important to allowing safe trade of food products. Currently, Codex has a task force on antimicrobial resistance, whose purpose is to define standards to minimize the potential for transmission of antimicrobial resistance through the food chain. This is a process that National Milk and the U.S. Dairy Export Council have been participating in for the past 5 years and following very closely the work that comes out of the U.S. government in their representation on the task force, but again, also with the International Dairy Federation. Back in 2016, I had the privilege of representing the U.S. dairy industry and the global dairy industry at a high-level meeting on antimicrobial resistance at the United Nations. At that meeting, the United Nations stated that antimicrobial resistance was a matter of concern globally. And having the dairy industry be part of that and the recognition of the importance of dairy in the diet of all people and the importance of judicious and responsible use was well received at that meeting. Finally, we work with our partners at USDA and the Food and Drug Administration on animal health matters, including the judicious and responsible use of antibiotics.
Thanks. And Jamie, can you maybe speak a little bit of how antibiotic stewardship and antimicrobial resistance and all that is a part of animal care? What's the relationship in the broader farm program?
Yeah, so when we look at the silos in the farm program, you'll see that antimicrobial stewardship has its own silo, but really when you think about it, it's really just part of the overall animal care program. It's a very specialized part about the use of antibiotics, but really it falls well within the animal care program, and so it's an adjunct and support to the overall animal care program. That being said, because there is so much interest about antibiotic use and concern over antimicrobial resistance, it does have an extensive amount of information that we share through manuals and other templates, which we'll talk about later under resources. And for those reasons, it's its own standalone program. In some cases, it actually predates the farm program because it came out about 35 years ago as a residue avoidance program at a period of time when there was residues in milk at the consumer level, predating the routine testing of antibiotics in milk. From there, it expanded into what is now the FARM Antimicrobial Stewardship Platform.
Yeah, you know, I think that one of the big questions we get in all of our program areas is how are stakeholders involved, how are dairy producers involved in decisions that are made and conversations were being had on the different topics. So can you share a little bit about governance structures and input from stakeholders?
Yeah, absolutely. And that's a great question. And I think what's important for our audience to recognize is that we have a deliberative process that we go through when we revise and update the best practices that are in the residue avoidance manual that is part of the antimicrobial stewardship platform. If you have joined the quick conversations in the past, you'll see that this very much looks like the governance structure that we have in the other parts of the program. We have our Farmer Advisory Council, which has dairy farmers from across the US on it, from small to large, organic and conventional. We have our Animal Care and Antibiotic Stewardship Task Force, which about 1/4 of those members are dairy farmers, but we also have additional experts on there, veterinarians, pharmaceutical manufacturer representatives from the test kit manufacturers that test for residues. That feeds into our National Milk Animal Health and Wellbeing Committee, which is composed of members from our dairy cooperatives, including cooperative staff and the dairy farmer owners of those dairy cooperatives. And then finally going into our National Milk Board of Directors. And at that level, 65% of our board members are active dairy farmers, with the other 1/3 being cooperative staff. And so I think you can see there that there's a variety of levels that we go through as the best practices in the manual are updated. And this provides a variety of levels of input to make sure that those best practices are not only good in theory, but can also work well in the field for dairy farmers.
So the other big ask beyond who makes decisions is what is expected of the dairy farmers themselves. So what are some expectations when it comes to antibiotic stewardship within the farm program for dairy farms?
Excellent question. And really, these go back to the Farm Animal Care Program. As I mentioned early on, really antibiotic stewardship is a part of the animal care program overall. And this is where we get back into some of the core requirements of the animal care program. The first is that written veterinary-client-patient relationship that's signed by the owner and the veterinarian of record annually. What that represents is that the dairy farm owner or manager is routinely working with a veterinarian to implement an animal health program. And that's that third part there. The written herd health plan is reviewed annually by that veterinarian of record. The facility also has permanent written or electronic treatment records for the treatment of the facility's common diseases. So when an antibiotic is used, the expectation is that the farmer is keeping records of what antibiotic was used for what specific condition, on what day, what animal, how much, and what the withdrawal times are. The expectation here is that we keep these records for a minimum of 2 years. There are actually some drugs that are used on dairy farms that can have extended withdrawals, particularly in meat. An example of that is gentamicin, where there can be residues of gentamicin in the kidney and livers of dairy cattle for 2 years or longer. Finally, we have the matching the written protocol and practice for the treatment of the common diseases of mastitis, metritis, milk fever, and so on. So these expectations on antimicrobial stewardship are actually within the animal care program. And so if you were to look at the best practices in the residue avoidance manual, you'll see that they mirror the antibiotic use expectations in the animal care program.
Thanks, Jamie. And obviously in 2020, we had to pivot a little bit and we're not able to implement the program as we probably originally intended or have as much involvement as we had hoped for with everything that went on. But we do have a little bit of data. So can you speak to what information we know now about what's going on out there on dairy farms?
Yeah, and certainly last year was a challenging year because of the pandemic. But we did have 2,805 facility evaluations that occurred as part of the Farm Animal Care Program. I just want to let you know that those facilities averaged 880 cows. We have about 32,000 total licensed dairy farms in the US that average about 290 cows apiece. So I want to be a little cautious here. We're not sure that the data I'm presenting now is representative or is not representative of the larger dairy community, but it is certainly representative of the 2,800 facilities that had evaluations done last year. And what we found is under the treatment records, 74% of those 2,800 farms were meeting all of the requirements, including permanent records, written or electronic, with date, animal ID, specific drug given for what condition, the amount, the type, the route of administration, and withdrawal time. We had an additional 11% of those 2,800 farms that had some records but did not have all of those specific details in. But we also had 15% that had no records whatsoever. And so I think what we see here is that we have a good story to say about farmers keeping records. We have some that have some records and need to work on improving the records that they have. But we also have a small part of our dairy farm community where we need to work a bit harder with them to help them get the record keeping systems in place for the antibiotics that they use so that they can demonstrate their commitment to antimicrobial stewardship.
So if a farm is not currently keeping records and they're curious about what means that they can go about starting that process and our practice, what do we know about how farms are keeping records now, by what systems?
So there's a variety of ways that records can be kept. The vast majority of dairy farms keep their records as written records. In some cases, they may have written records that they then put into their electronic systems, such as DairyComp or PC-DART. There are some farms that will do temporary record keeping, such as on a dry erase board for cows that are treated with for mastitis, for example, so that they do not accidentally milk that cow and put that milk into the bulk tank. But what we see is that there's a variety of systems that can and do work for dairy farms, and that there's no one system that has to be used by every dairy farm. It's the system that works best for the individual dairy farmer. Much like the animal care program, where we look at outcome-based approaches, the outcome here is that well-maintained records help minimize the unfortunate opportunity of having a residue. Ultimately, it's illegal to have a residue in your milk, and it's illegal to have a residue in an animal sold to slaughter. And so by having well documented records, you can help minimize that. And whether that's a written record by an individual animal sheet, or a written record that is by day, or computer records through DairyComp, PC-DART, or other systems, what we find is that keeping accurate records helps to minimize the potential for having a residue in meat or milk.
And so we pride ourselves on the farm team of making sure that we provide resources that can be used on the farm to meet the standards and expectations of our programs. So can you speak a little bit about what resources we offer in this area?
Absolutely, and we offer a variety of resources. The first thing you'll see there is the overall residue avoidance manual for milk and dairy beef. In the front part of that manual are the best management practices, but also in there are tables that include all antibiotics that are approved for use in our dairy cattle, from our calves through our heifers, our lactating cows, and our dry cows. Additionally, after that, there are tables that include the test kits that can be used for testing for residues in milk, or the way that we test for potential residues in meat is often through either a blood test or a urine test. And so that manual itself is a valuable resource for all of those reasons. We also have a smaller version of that, a little pocket guide that is the list of drugs in the tests. We also have on the website a variety of templates that farmers can use for recording their use of antibiotics. And they are customizable. They contain all the required elements that are part of the best practice for record keeping, but they can be utilized by a dairy farmer in a manner that works best on their individual dairy farm.
So, you know, having a residue or knowing what the occurrences of residues are may not be something that everyone's familiar with if they haven't, previously had a discussion about the broader dairy industry or haven't had an issue on your farm, on their individual farm. So what do we know about what the dairy industry has done in terms of preventing residues and lowering the consistency of residues over the last couple of years?
In general, we've got a great story to tell about the reduction in residues. All milk that is sold commercially from a dairy farm for processing in the US is tested for antibiotics. It's a requirement of the Pasteurized Milk Ordinance. And what we see here is that over the last 24 years, we've had a reduction of about 90% in the incidence of residues being found in a milk truck. When a residue is found in a milk truck, each farm that has placed milk on that truck then has its own individual sample tested, and the farm that caused the residue has a couple of things happen. First, they're responsible for the value of the milk on that truck for the other farmers. They are also responsible for finding an appropriate disposal mechanism for that milk. And if they are a repeat violator, they could actually either temporarily or even permanently lose their license to sell milk. And that mechanism, that feedback mechanism that we have through the pasteurized milk ordinance has worked very well in reducing what was a very low number in 1996 of about 1 out of every 1,000 truckloads having a residue to what is now about 1 out of every 10,000 truckloads having a residue. And when that residue is detected, that milk cannot be processed and sold into the commercial supply. And so that, I think that's a really great story. And you can see, you know, as we get to smaller and smaller numbers, we don't have big changes from year to year, but we continue to have that trend of further and further reductions in the incidence of having a residue in a milk truck. We don't have data for quite as long, but we're also seeing, I think, good trends on the dairy beef side as well. So while every bulk tank truck load of milk is tested for antibiotics as required by the pasteurized milk ordinance, on the meat side, USDA inspectors do a risk-based process for selecting animals for residue testing based upon what the animal looks like when the animal first goes into the slaughterhouse, and then based upon aspects of what the carcass looks like once the animal has been slaughtered. What we see here over the past 6 years is a reduction in our dairy cull cow tissue residue violations of about 40%. That big bar at the bottom is penicillin. Penicillin, a beta-lactam drug, is the largest percentage of the violations that occur. You'll see there that we had a little over 700 animals that had a violative drug residue in 2014, and we're down to about 400 in 2019. And that is about 400 animals out of over 3 million dairy cows that go to slaughter each year. So it's a very low number out of the total, but I think an important thing to remind folks of is that while it's a very low number, dairy cows themselves represent nearly 50% of total residue violations that USDA finds at slaughter. And that's across all animals. So all dairy cows, all beef animals, all swine, all poultry, all small ruminants like sheep and goats. And so dairy is a small number of residues, but a large proportion of the overall residues found. And then I think we've got one more slide for residues, which is in Bob Veal. So Bob Veal are the male calves that are not fed out as either what is called fed veal or going into the more traditional beef market by becoming a dairy steer. So these animals are going usually from the farm to slaughter without growing them out. And what we see here is actually a reduction of about 70% from 2014 to 2019. One of the big changes there is in between 2014 and 2015, where you see that large drop, is that there was a change in the over-the-counter availability of medicated milk replacer. So what was happening in that green green bar that's really been reduced is that people were incidentally using medicated milk replacer and feeding their Bob Veal calves before they were sold, resulting in residues. In 2015, medicated milk replacer was no longer available over the counter and required a prescription. And so that was a big change that resulted in a reduction in residues. Still, even without that, we're still seeing a decline in residues over time. When you add the Bob veal and dairy cull cow residues together, they're nearly 75% of all residue violations. And so again, very small numbers, but the dairy industry does represent an outsized proportion of the residues that are found in animals at slaughter by USDA.
So if a dairy farmer was to have a question, additional questions on this topic or related topics, where could they find out more information in terms of how to reduce residue information, how to keep treatment records, just more information about the program in general?
Yeah, in general, the nationaldairyfarm.com website is our resource for templates, the best practices manual, which also includes the approved antibiotics and the test kits. Certainly, conversations with your farm evaluator and your veterinarian are key on helping to put together a record-keeping system that'll work for you and for particularly your veterinarian, that herd health plan that first looks to minimize the occurrence of disease, and then if disease happens, what you're going to do to treat the animal. And that treatment may include antibiotics or it may not. It depends upon the disease condition and what you have agreed upon with your veterinarian for the right course of action for treatment.
Thanks, Jamie. And as we are coming up on time, we do have a few moments for questions. So as a reminder, you can submit your questions either via Zoom or on Facebook. We do have a few that have came in. Jamie, can you speak a little bit about medicines that are not considered antibiotics, vaccines, Banamine? Are those things that can create residues in milk and meat? Do they have withdrawal times?
Yeah, so there are a number of drugs that are used in dairy animals that are not specifically antibiotics, and they can cause residues, and therefore they do have withdrawal times. Vaccines, for example, actually have a minimum of a 19 or 20-day meat withdrawal time. Vaccines are regulated by USDA and not FDA, but they do have a meat withdrawal time. There's also some porons, for example, that are utilized in growing animals for control of grubs, that if you accidentally use them in your lactating animals can lead to milk contamination for extended periods of time, 10 days, 20 days, 30 days or longer. And so there's a variety of other non-antibiotics that are used in dairy animals that can cause residues in meat and milk, and therefore you first have to make sure that you're using the appropriate drug on the appropriate class of animal, and then two, always follow the required withdrawal times.
So where would someone find out what is considered to, or what is required to be a part of a treatment record?
So we have that both in the Farm Animal Care Manual and in the Farm Milk and Dairy Beef Residue Avoidance Manual. So those are the best places to go and see the elements that you need on there for a full treatment record.
And the last question is, are asked that they know in Europe there any drugs or all drugs have to come from the veterinarian. Is that something that we will expect to see in the US, or where are we headed here in the States?
I would say where we're headed in the US is that the few remaining antibiotics that are available over the counter are probably going to become available by prescription only in the next few years. There's only a handful of those that are approved for dairy cattle at this time that are still available over the counter, but they will likely be moving to prescription only in the next few years. That being said, in Europe, in many parts of Europe, you get that antibiotic by prescription directly from your veterinarian. And certainly that does happen here in the US, but just as with other prescription-only antibiotics today that you can get at your farm and feed store, that will still happen in the future. And so we don't see that it's a necessity for antibiotics to only come from veterinarians, but what will happen in the future is that probably all antibiotics will be required to have a prescription to be able to purchase that antibiotic and then use it in your herd.
Thanks, Jamie. One thing that I will add is Jamie spoke earlier about our drug residue manual, prevention manual, and our pocket guide that we have available in Spanish and English. The 2021 version of those resources should be available about the middle of February. So look for those on our website around that time. They're available to view digitally online, or if you're looking for a hard copy, you can purchase that in our store or visit and ask your farm participant for that resource as well. As a reminder, our next quick conversation will be January 16th at 1 p.m. Eastern Time, and we'll focus on farm workforce development with Nicole Ayash. If you have any questions or you want to follow up with anything that we discussed today or anything else related to the farm program, you can check us out on our social media channels there, or at our website, or at dairyfarm@nmpf.org. Thank you guys for joining us, and thanks for Jamie for sharing about the farm program.
Thank you.